Okay, good luck, everybody. I have a new microphone this week, so I hope it's working. Rav Shmuel, can you tell me if you hear okay?
I hear loud and clear, Rabbi. Thank you.
Okay, great. So Shavua Tov to everybody. Good luck. Hope everybody had a nice Shabbos. And as we're getting closer to the Yom Hadin, Mirz Hashem, all of us, a lot of people have told me that they've completed their first time going through the Kapitluch of Tehillim, and they're up to starting their second time, as we talked about, the famous Motzei Ephraim, for people to do the entire Kapitel of Tehillim twice during the month of Elul. So if you didn't do it the first time, it's not too late to do it one time. Do 10 Tehillim every day, the 15 days that we have until Rosh Hashanah, and Be'ezus Hashem, it's a tremendous chus for yourself as well as for all of Klal Yisrael. We read in today's parsha the words "V'samachta b'chol hatov," that we should be happy with all of the good that HaKadosh Baruch Hu has given us. And in this difficult time of COVID, we sometimes don't fully appreciate and express our hakaras hatov to HaKadosh Baruch Hu for all the wonderful things that we had. I was looking around in shul today, and Baruch Hashem, we had a beautiful minyan. It was pretty much unrecognizable from previous to all the COVID nonsense. The minyan was a large minyan. People were spaced, wearing masks. Other than that, beautiful minyan with beautiful davening. I think that we have so much to be thankful for, we sometimes forget to. But the pasuk also tells us that you have to be thankful, v'hager asher b'kirbecha, that if we're not fully understanding that if we're happy but other people are not happy, so then that's really not fulfilling what HaKadosh Baruch Hu asked us to do. And sometimes the word ger can be translated as a stranger. So I'll take the liberty of translating it as estranged. There are people in the community that are estranged. There are people in the community that are very concerned about going into Rosh Hashanah, Yom Kippur, Sukkot, without having family, without having friends, without having company, because they're terrified still about COVID. And we need to make sure that nobody is estranged. Hager asher b'kirbecha has to mean that even if we are socially distanced, that we cannot forget the needs of all of the people in the community. And whether it's phone calls, whether it's coming by the house and sitting with them outside, whether it's making sure that everybody has the essentials for Yom Tov, people in difficult financial situations, the economic troubles that people are having. If anybody does have troubles, please, they need to make sure to reach out to the shul so that the shul can help you. If you're not a member of our shul, to reach out to your Rav, to reach out to your administrations and the shuls that you're at. Nobody should be going into Yom Tov without all of the essentials. And certainly everybody in Klal Yisrael should be not left alone. As difficult as this Yom Tov will be, still in terms of not having the company that we might be used to having in the sukkah, not having the usual meals in exchange of families that we might have under normal circumstances, and that will be curtailed greatly this year still. We have to make sure that everybody's needs are met. So that's a very important idea. I think it's also very important that as a lot of, quote, social media presence is out there, everybody feels that they're entitled to give their opinion, whether they're a lay person and have zero experience or knowledge, but everybody feels that they're entitled to an opinion. And scientific data seem to have absolutely no importance to people. Objective facts seem to have no importance to people. The unanimity of the medical community, a letter was sent out by 138 physicians from the 5 towns. The only complaint I've gotten about that letter is, how come you didn't include me? How come you didn't include me? So it was a whole group of physicians that started this. It wasn't me, although I did participate obviously in it. And we don't have a listing of all of the physicians in the 5 towns. And not one physician that I know disagrees with this. That's 100% unanimity in the physicians in the 5 towns for sure. And the only complaint I got about it was people think that I didn't sign the letter and therefore I don't agree with it. So I want everybody to know, publicly stated, if there is a physician in the 5 towns that disagrees with the letter, please have them contact me. And we are more than happy to have additional physicians join in letters like this and any future letters that need to be written for the general benefit of the community so people can get accurate information. If you're getting your information from social media, if you're getting your information from unvetted websites, from non-professionals, people who have absolutely no credentials to give you an opinion. So then you get exactly what that is. You get a person who has no credentials giving you their opinion. If you want medical advice, you need to go to the CDC websites. You need to go to professional society websites. You'll get unbiased, objective opinion. And it's very funny. Other than with COVID and masking and social distancing and with vaccinations, by the way, there are almost no areas of medicine where there's unanimity. You have lots of machlokas in medicine on many, many issues. Whether you screen for cancer with this methodology at this age, whether treatment of this illness is best done with medicine A or medicine B, there's always machlokas in the medical field. It's an inexact science. It's so funny that when it comes to social distancing, appropriate masking, appropriate hand hygiene, appropriate vaccination, there is essentially 100% agreement by all of the experts in the field. You find this nowhere else in medicine. And yet, it's so funny that that's the one area where there seems to be more misinformation and people without the right to have an opinion from a medical from an expert point of view, still providing their opinion. Now, everybody's entitled to give their opinion, but Lani as Dati, you shouldn't be listening to opinions that aren't expert opinions. Then the last thing I wanted to say is Pasuk in Rashi, where he explains, Hashkifa mima'on kochecha min hashamayim. And Rashi says the bracha that I want to give to everybody. Rashi says, we say to HaKadosh Baruch Hu, we are doing what you asked us to do. And therefore, HaKadosh Baruch Hu, do what you said you would do. Give us all this bracha, give us all the beautiful things that you said you would give to us if we do what you say. And I want to quote from social media, an expert opinion. Now here, this is the halachic expert opinion. I've been quoting many, many different poskim throughout, but I saw such a beautiful statement from Rav Brudny Shlita, the Mir Rosh Yeshiva, one of the Moetzes Hagdola from the Agudas Yisrael. And he stated, and this is his halachic opinion, he's not an expert in medicine, but he's an expert in halacha. And he's spoken with numerous medical experts, not only myself, but numerous medical experts. And his opinion is that you should wear a mask. And that he says it's a terrible chinuch to our children. Listen to what he said. He said it's a terrible chinuch to our children when they see and read and hear that professionals, experts, the government say you should wear a mask, and you tell your children, nah, you don't have to wear a mask. He says it's a terrible chinuch for our children. You're telling them they don't have to listen to expert opinion. They don't have to listen to halachic opinion. And that's Rav Brudny Shlita from the Aguda. And that certainly is the opinion that we've expressed many times from many other Gedolei Yisrael. I just saw this on Friday, so I thought it would be kedai to bring it to everybody's attention. And the last thing I wish to state is really more personal for the Young Israel of Women membership. This was a very, very important Shabbos for us in terms of transitioning. I mentioned in Shul this morning, I spent the whole drasha in Shul this morning talking about this. So I just very briefly say that Klal Yisrael in the parasha that we're in right now is finishing up 40 years in the Midbar. And from the Young Israel of Woodmere, we are blessed to have had the leadership of Rav Herschel Billich Shlita as Amar da Asra for the past 40 years. And he has retired. And this was the first Shabbos that Rabbi Shalom Axelrod Shlita is the new Mara da Asra of the Young Israel of Woodmere. So I wanted to first and foremost acknowledge the personal debt that I have to Rabbi Billich Shlita in allowing me to play any role that I played in at the Young Israel, giving shiurim, being on the rabbinical staff. And it's through his unbelievable tutelage and through his unbelievable status as a community rav par excellence, and as a Talmud Chacham and as a wonderful person leading the Woodmere community for 40 years. It's been such an honor and a pleasure, and there's tremendous hakaras hatov for the community growth, and everything that's positive in the community is, to a certain extent, due to his leadership. And it's a pleasure to also continue to work under Rabbi Axelrod, who's been at the Young Israel now for 10 years. And we look forward to him bringing us to, as Moshe Rabbeinu did, to bring Klal Yisrael to the point of going into Eretz Yisrael. So we look to Rabbi Axelrod Shlita to bring us into the Gula Shlema, to lead us to Eretz Yisrael b'mehera b'yameinu with Mashiach Tzidkeinu. Many questions I've gotten this week regarding the vaccine. And the government, of course, put out some statements, which, again, I'm apolitical. I'm not here to talk politics. I'm not an expert in politics. Why would anybody listen to me about politics? So I'm here to talk about the facts. I'm here to talk about the vaccine. And there is a tremendous amount of good, positive, good clinical information that has been published, including a paper just on Friday in the Lancet that was looking at the Russian vaccine. There are numerous other papers that are potentially showing each step of the way that we are successful with many different vaccines. There are 9 vaccines now in stage 3 or phase 3 clinical trials. I try to give a very brief overview because I get so many questions about this, and people are appropriately concerned as to whether this will be a safe and efficacious vaccine. So I don't know the answer to that yet. I can only tell you that to date, everything is going almost as well as you possibly could have asked for in every one of the vaccine trials. And let me explain what possible routes of vaccination there are, because I think it's very interesting. And I think that there is going to probably be decisions that people, governments, local states will have to make in terms of which vaccine they wish to use. So there is one vaccine category that I'll just mention. It's not being looked at in the United States, it's looked at in China, and that's to use a weakened, what's called an attenuated live virus. And there are long, detailed years of study of such vaccines in other diseases, and they work perfectly well. And for whatever the reason, that is only being looked at right now by the Chinese. So I'll leave that out because that's not going to be a consideration for usage here in the United States and in probably most parts of the Western world. So the main types of vaccination candidates that will be looked at are some standard types of vaccines, such as using a coronavirus or cold virus that is totally different, well, not totally different, but is not the novel coronavirus COVID-19, using a cold virus or more likely an adenovirus. And that's where most of the work to date has been in adenoviruses, which are other types of cold viruses, not coronaviruses, and using them to deliver the type of protein that is found on COVID-19. And when you give this very simple and safe vaccine to people, so what it does is it causes the person's body to go and manufacture antibodies and build up immunity against that critical protein, which is found in this artificial virus, this adenovirus, or in some of the studies, they're using not human viruses, they're using chimpanzee cold viruses, chimpanzee adenoviruses. And I'm not going to get too technical to say why one would be theoretically better than the other. Each has advantages, each has chesronos, each has theoretical positives and negatives in using a human cold virus versus a chimpanzee cold virus to deliver the spike protein or to deliver some sort of an antigen to the human body that gets this dead virus and will develop immunity theoretically to COVID-19, because you'll recognize COVID-19 because you recognize or have been taught to recognize it by giving these other virus vehicles that are dead viruses, but have this protein on them, this spike protein that will allow you to go and develop immunity. That's two types, this either human adenovirus, cold virus, or this chimpanzee cold virus, adenovirus. Another way that you can give this is just directly give the protein, that the spike protein, and have the body just manufacture antibody immunity to that. And that's not as far along yet, but that's a potential as well. The first two, the adenovirus from a human or an adenovirus from a chimpanzee, those are pretty far along right now. And there is a chance that they'll be potentially available in 2020. And I'll talk about that momentarily. But first, let me tell you about the other two viruses, two vaccine candidates that look at a different way of developing viral immunity. And that's a novel way, which we have no prior experience with, but it is an exciting new technology. And that's to provide mRNA to the body. And that will cause your body to manufacture the spike protein and immunity to it. And therefore, when you do get exposed to COVID-19, you will already have antibody and you'll be able to attack it and it won't be able to hurt you. Those are the theories. So you basically have a live attenuated virus, which we're not going to be using in the United States. You have different types of vaccines that will incorporate dead human adenoviruses or dead chimpanzee adenoviruses, or vaccines that will give you mRNA or potentially protein to go and develop immunity. There are several of these, at least 3, maybe 4, that might be available in 2020. And that's what the whole hullabaloo was this week when the government said that there's a chance that they will make an emergency use authorization, what's known as an EUA, to allow these vaccines to actually be given to people outside of a study setting. There are studies underway right now. Again, I'm still hopeful that we'll be starting our study. Some of the political announcements have turned the vaccine testing world around. So a lot of the companies are having second thoughts about doing some of their studies. So we were scheduled to start October 1 using a human adenovirus model, the J&J virus product. And I'm hopeful still that we're able to do that, but everything is on hold right now because of the different calculations that are being made by some of these companies in terms of this emergency use authorization. In any event, there are going to be results from some of the phase 3 trials probably in October. And based upon those results, the scientists, the experts will have to decide 2 things. Are these vaccines safe? That's the first and foremost. Nobody will be getting any vaccine that's not considered safe. The second is how effective are they? The FDA months ago already said that if a vaccine can show a 50% efficacy, which is wonderful, but not certainly perfect by any means, if it can show a 50% efficacy, it will get approved, assuming, of course, it meets the safety parameters that are essential. So this is critical to understand that there will be data available probably in late October regarding efficacy and safety of some of these vaccines, possibly 3 of them. And more will come in November and in December for some of the other vaccine candidates. And therefore, assuming, and again, it's an assumption, based upon everything we've seen so far, I think there's an excellent chance that there'll be good results, but we don't know that now. And anybody that says that they know the results is just not telling you the truth. They're just not available yet. But there is an excellent chance, based upon the preliminary work that's been done, that some of these vaccines will in fact be available. The data from them will be available, and the government has the potential to allow emergency use authorization and allow people to get them. Now, they're not going to be available at your CVS or Walmart right away, but they will probably prioritize them and give them to healthcare workers first, and give them to certain populations first who are either at the most risk or in the most need of getting such vaccines, like healthcare workers. The question that everybody wants to know is, should I take such a vaccine if it's available? Are you crazy to take such a vaccine if it's available? So my philosophy is, I can't tell you the answer till I know the data. And people who think that this will be a political decision are potentially correct in that some of this is political in terms of speeding things up, but I can guarantee you that the infectious disease world will be up in arms if the data don't support any emergency use authorization. And this is something that will be public. This isn't something that's going to be made behind closed doors in terms of the data. The data will have to be made public. And then once the data is made public, obviously we'll have a chance to analyze it. Assuming the data are good, again, safety first and foremost, and efficacy. So then I certainly would recommend that people in the highest risk categories take such a vaccine. But it's too early to make such a recommendation without knowing for certain what we're talking with. But in theory, if efficacy can be shown and safety can be shown, so then we have lots of experience with these vaccines. The long-term concerns, which we'll never know about till 50 years from now, obviously we can never predict. But I never heard anybody say about any other new medicine or any other new treatment or new food that, well, maybe 50 years from now, this could cause cancer. If there's no reason to think so, and again, with most of these vaccine models, there's no reason to think that they do anything. You're giving a person a dead protein. You're giving them dead material most of the time, which is naturally occurring in most situations and is not expected to do something like you read about in B movies that it's going to cause a tremendous disaster to the entire world. Again, we have experience with vaccines for 200 years. And certainly with the modern vaccines, we have tremendous experience, and the safety record of the modern vaccines is phenomenal. And therefore, again, people obviously have to make their own choice. If and when the vaccines are efficacious, and if and when the vaccines are shown to be safe, so then I would recommend them. More to come on that. We still have time. Right now, it's just very, very exciting. I do think, and I've said this multiple times, that this will be a game changer if, in fact, we have a vaccine that's safe and efficacious, because that is the fastest way for us to go and return back to a normal society. There are a number of other things that I wanted to talk about that are very hot in the news. Saliva tests. There's a paper published this week that actually suggested that there is a test that can be done on saliva that is as accurate. In fact, it was more accurate than some of the PCR tests right now being done on the nasal pharyngeal swabs, the swabs that you stick all the way back of the nose to get a good deep specimen. So if this is true, and if this pans out and is easily available, this is different than the other saliva tests that I've been talking about previously. So this would be a game changer as well. And the cost of these tests is going to be a critical factor, because if they're very expensive, they can't really be used on a regular basis. But if these tests are able to be made, like the less sensitive saliva tests, that might be very, very cheap. So then these could be used as a very valuable tool for businesses to stay open, for schools to stay open, for all sorts of public activities. If you could screen rapidly with these types of tests, so then it would make them much safer venues, even in situations where right now for example, in New York City, you can't go to indoor dining. So if we had such tests available, so I think that would allow many businesses and an economic recovery to occur much faster. There was a number of papers published this week talking about ventilation and aerosolization of the virus. Not tremendously new information, but they reiterate the importance for schools to go and make sure that their ventilation systems are as up-to-date as possible, using the appropriate filters as possible. And again, they give tremendous credence to the idea of social distancing within schools. As good as your indoor system is, it's not as good as the outdoor system that HaKadosh Baruch Hu made. And therefore, again, I want to stress, I think indoors is safe, just like outdoors, but you have to make sure that you're not cramped, it's not too tight, and it would be, in my opinion, preferable to daven outdoors if the spacing was better, rather than indoors if the spacing was poor. But if the spacing is identical in both places, I think both can be safe. There are a number of new papers coming out this week that supported some of the treatments that we've been giving for COVID, and that's very important because they reiterate that our ability to treat COVID today is better. And when to use steroids, for example. So some major papers came out supporting the recommendations that we've been using for several months now, that the sicker patients really should be treated with steroids, but not the healthier patients. And the same thing, there's some data about some of the immune modulator drugs that has come out that also, again, I think are very important for the clinicians. I'm not going to go into the details here, but this is probably one of several reasons why, Baruch Hashem, even as we are still seeing, I get calls from doctors every day, I have this many positives, new positives. There's a significant still increase in positive cases compared to a month ago. Now, we probably in the 5 towns are one of the hottest spots in our general area, certainly in Nassau County, but probably even in New York City. So that's something to be aware of. And almost all of the cases are related to weddings. It's straightforward and simple. Some of the weddings are mini super spreader events. And again, I can't stress enough how people have to be careful with these things. And there is no alternative. You cannot go and not wear a mask. It's going to be potentially dangerous. We've seen it. There are multiple cases from some of these weddings. And again, it's going to impact schools. It's going to impact Yomim Noraim. And if people aren't careful, I don't know what to say. The question I get, well, how come we aren't seeing hospitalizations? So first of all, there still are hospitalizations, Baruch Hashem, very, very few, but there still are hospitalizations. But many physicians are treating their patients outside of the hospital with some of these drugs that do not require intravenous. And therefore, our knowledge is better. We're able to treat some of these patients outside the hospital, and ask your local physicians. They're doing this for their patients. I spoke with one physician Erev Shabbos, and he told me he has 2 patients right now that previously would have been hospitalized, but now we're treating them outside of the hospital. And that's the experience of many physicians. Now, again, Baruch Hashem, we're seeing less very sick patients. And the reason for that is the average age of the positives is probably 20 years younger than it was back in March and April. There is absolutely no evidence to suggest that the virus has changed and that the virus is not as severe. Nebuch, look in Eretz Yisrael. Look at other parts of the country. Look at other parts of Europe. They're seeing the same exact rates of serious illness when you look at the same populations. So there's no evidence to suggest that the virus has changed. And people that mistakenly think that the virus has changed and now they can do whatever they want, so they're unfortunately making a mistake as well. Last thing I want to mention is just an interesting fact. There's an interesting study that came out to explain why men seem to be more severely affected with COVID-19 than women. Lots of postulations, lots of guesswork, but there was a nice paper that suggests that there are some immunological mechanisms. The way women react is different than the way men react for various reasons, and that would explain some of the differences in mortality. Men have a higher mortality in general, higher morbidity, higher mortality across all age groups and across all underlying illnesses than their female counterparts. And therefore, there's some immunological mechanisms that need to be explored further, and that exploration may as well allow us to understand better how to treat this illness. I think I've covered most of the things I want to say. I know there are a lot of questions about flu shots, so I'll address them as well. I get a lot of questions, people asking me. There is absolutely no evidence in any year that taking the flu shot earlier is dangerous or worse than taking it later because you're concerned that you'll lose your immunity. There's no evidence to support that. In regular years, I tell people if there's not a lot of flu around, we monitor how much flu is around. I can tell you usually how many tests are positive in our hospital. I can tell you what's going on in the community. So when there isn't yet a large incidence of flu, I tell people there's no rush to get the vaccine. You get it as soon as you can. This year, the CDC, and I think it's a smart recommendation, have been recommending that people get vaccinated now. I've mentioned this before. I'll mention it again because I'm still getting a lot of questions about this. I think there is zero risk in getting the vaccine now as opposed to a month from now. The theoretical concern is that maybe it will not last. It's A, there's no proof for that. B, worst comes to worst. If we're experiencing a huge April, May flu outbreak, so then we can always get vaccinated again, should that be necessary. I doubt that will be necessary. And in fact, I think that there's a chance that because people are masking and social distancing, we should have, hopefully, b'li ayin hara, less of a flu problem. That'll be the hidden benefit of COVID, is that less people will die of flu because people are protecting themselves against COVID, which also protects against it. So, Reb Shmuel, at this point, I'll take any questions.
Okay, I'm going to combine 2 questions that were asked. Number one is, people talk about a second wave. Is that something that's a guarantee that we will have a second wave? And is this virus something that will always be around, or will it dissipate over time?
So I think the answer to both of those questions is I don't know. It's very important for us to always realize that there are a tremendous number of things with COVID-19 that we just don't know. We in the hospital have drills after drills to prepare for a second wave of COVID. We have all these contingency plans, what we'll do. And Baruch Hashem, they worked so unbelievably well when we prepped and prepared and were able to handle. We almost were overwhelmed, but we, Baruch Hashem, were not overwhelmed because of all the preparations and time and effort that we put in to make sure that we could convert units into being COVID units, that we could convert areas that weren't ICUs into being ICUs, and that we could convert space in the hospital for doing things differently. So we are preparing for a second wave. The government is mandating that everybody prepare for a second wave. But again, it's like when you carry an umbrella outside, that's a guarantee that it won't rain. So I hope HaKadosh Baruch Hu should be kind to us, that all of our preparation should be for naught. As I've said over and over again, I hope all of my cautioning about masking and social distancing is wrong. Nothing would please me more than to say, it went away on its own. But that's not the way medicine works, and that's not the way halacha works. And a person has to prepare has to do his ishtadlus and make sure that we do everything possible to prevent a second wave. Will there be a second wave or not? Only HaKadosh Baruch Hu knows. There certainly is a chance. In regards to the second part of your question, can you just repeat that, please?
Yes, is the virus something that will always be around, or will
Right.
it dissipate over time?
So I think that's also, again, something that's unknown. There is no experience with this novel coronavirus. The other two novel coronaviruses, one is around and one is not around. So SARS-1 went away. We don't know why. It was here in 2002, a little bit in 2003, one or two cases in 2004, and it never has recurred. Not a single case since then. MERS, Middle Eastern Respiratory Syndrome, is the other novel coronavirus that appeared in 2012, and it reappears every year, but it's geographically isolated. We understand a little bit why that is so, but we don't understand why it recurs. So nobody has experience. Anybody tells you that it's a seasonal virus is guessing. It's only been here for one season. It only came about December of 19. So we're not yet through a season. So I have no idea whether it will be seasonal or not. If it acts like cold virus, like the normal coronaviruses, so then, yeah, it'll be very seasonal. If it acts like SARS-1, which it's mostly closely related to, I can't tell you that it'll be seasonal. We just don't know. Ask me this question, Motzei Hashem, a year from now.
What percentage of a class would have to be infected for you to advise them to cancel the class?
So I don't have an answer to that. I don't think you can give numbers to something like that. It depends on the circumstances. Was there an event that triggered all of those people being positive? Did they get it from the school? Are they getting it from the school? Are they getting it from outside of the school? What age are they? How sick were these people? I think that there are too many factors that I couldn't give a general answer. And I think each yeshiva, each school has its own medical professionals that they're relying upon. And they're all, again, kol hakavod. It's a hard time to be school administration, school Rosh Hashiva, school principal. There's tremendous amount of work that they've been doing preparing for this. B'ezras Hashem, they should be successful, but we all have to be helpful to them by trying to avoid situations where ourselves, our children, the teachers, the administration, and the children shouldn't be exposed. So that's the best eitzah that we can do at this point in time.
Turning to questions relating to upcoming Yom Tovim. Let's talk about duchening for a moment. The Kohanim usually get together and usually not socially distanced, and the Leviim washing the Kohanim's hands. What is your opinion on that?
So again, I think that we do need to socially distance at that point in time. It's a very short period of time. It shouldn't be done, it shouldn't take 15 minutes. So you should be hopefully limiting the exposure, but I think people should be standing at a distance apart, that you all should be masked. I think there's no problem with using the same cup. If people wash their hands before they touch the cup, they should wash their hands after they touch the cup. So therefore, the cup really isn't going to be a mechanism of transmission of illness. Interesting study came out this week that they looked at the cell phones of people with bona fide COVID, active, contagious COVID, and they only were able to isolate from their cell phones. And imagine somebody in quarantine, how often they're using their cell phone. They're only able to isolate from 2 of the cell phones COVID. So as we've mentioned, the contact, the touching stuff is probably not the most effective means of transmission of COVID. So I doubt that if people Purell their hands before they touch the cup and they pour it on the Kohen, and then the next person Purells his hand, touches the cup, Purells their hands afterwards, I don't think that that's a serious risk of transmission. I think if we, again, have appropriate lanes and appropriate distancing, I think we can do duchening in a normal-ish way as well.
In the Youngzilla Woodmere, we do not allow use of the Sidurim and the Chumashim. People are told to bring their own. How long is that going to continue, or could we lift that ban at this point?
So I think, again, it's probably not a significant concern of transmission. The theoretical concern would be if somebody's davening at the 6:30 shachris, and then somebody takes that same siddur that they just used at the 7 o'clock shachris, and then somebody takes the same siddur at the 7:30 shachris. So theoretically, if they're coughing, again, most people are masked, they're not going to really get anything on the siddur, but that's the theoretical concern. I doubt that that's a serious form of significant transmission, and if a shul chooses to allow the Sidurim and Chumashim to be used, I would be fine with that. If on the other hand, they say, listen, what's the big deal to bring your own sitter? So I'm okay with that as well. I think that's a personal decision that each shul should make. There are no data on it. I don't think it's a highly likely form of transmission. And if a person is at all concerned about it, so bring your own sitter, bring your own chumash.
For Rosh Hashanah, what's the best location for the Baal Tokeya to blow the shofar?
The best location is as far away from the tzibur as possible. Again, the Shulchan Aruch, it brings down, I mentioned this previously, Shulchan Aruch, it says that normally we blow at the bima where the Sefer Torah is laid, and we're showing HaKadosh Baruch Hu, we take your Sefer Torah, we learn from it, we learn from it, and that's why we blow the shofar there to give us an additional benefit in the eyes of HaKadosh Baruch Hu. So Rav Willig Shlita, I specifically asked him this question, and I said, do we at all concern ourselves with this year? And he said, absolutely not. Should blow as far away from the tzibur as possible. So whether that's outside theoretically, halachically 100% fine, as long as the person blowing is intending to be yotzei all the people inside. So then people inside intending to be yotzei with that tekiah, perfectly fine. That's probably not doable in 99% of the shuls. In an outdoor minyan, just have the person blow all the way in the front of the shul, have the shofar angling away from the where the exhaust comes out from the shofar, the sound comes out from the shofar, blow it in opposite direction from where the tzibur is. In an indoor minyan, go into a corner, go into another room. If there's a doorway into the shul, so have them blow in the doorway with, again, the kolos going towards the hallway, or towards an open window, or just into a corner someplace, as far away from the tzibur as possible. Where it's impossible, so if he's blowing in some sort of an enclosure, like for example, we have by the Aliyah, so blow into something like that, and that will, consolidate any exhaust, any potential COVID. I've also mentioned if it happens to be that the person blowing the shofar is a recovered person from COVID, so that's an additional benefit. It's very unlikely that he will transmit. We have mentioned that there are now cases of a second episode of COVID, but again, those are extremely rare, and they're only usually after several months after the first COVID in the few cases that we have. So again, that's an additional benefit, but I don't recommend that we look only for Bali Tekiah or Bali Tefillah that have had COVID. It's a nice plus if they have.
There are several yeshivas in the neighborhood that have said that if somebody went to a wedding, they should not come back to school for 8 days. Where did the 8 days come from?
So I'm not sure. It's not to my knowledge, that's not a medical date. And I think it's a policy that yeshivas have adopted. I'm not against it. Don't get me wrong. Sometimes we have to make policies to understand the seriousness of it. If people are going to weddings, if they're masked and socially distanced, so then there's nothing wrong with going to such a wedding. My experience has been that oftentimes they're not masked and socially distanced, especially the boys dancing in with the chassan and dancing like we're used to dancing at a chatzana. And now is not the time, unfortunately, to dance at a chatzana the way we used to. I've given some suggestions how we can have appropriate dancing in a chatzana, how we can misameach the chasana kala. Baruch Hashem, we're having regular weddings. Maybe we should always keep them cut down in size somewhat. Not the worst future recommendation that we shouldn't have 800 people at every wedding. There's nothing wrong with having a wedding with only the people that really care about the chassan and kala being there. It's a non-COVID shaila, whether that's a good eitzah. If people are going to weddings and they're not properly protecting themselves, and they're potentially exposing all the people in the yeshiva, I don't think people have a right to do that. And the yeshivas, those that have made these policies, I call a kavod. I think it's a very good policy, whether it should be 8 days or it should be 14 days, which is the normal period of quarantine, or if somebody is masked and socially distanced, there should be zero concern. So each yeshiva, each shul needs to make the policies that they think are most appropriate with the medical guidance that they have. Some of this is guesswork. So there aren't strict guidelines as to whether somebody needs to be quarantined if they've gone to a wedding. But certainly if there is COVID at the wedding, so then those people need 14 days of quarantine. 8 days is not enough.
There's a question about, they like your opinion about a CDC recommendation that no test is required if you were less than 15 minutes with somebody that turned out to be positive for COVID.
So the official definition of an exposure is to be within 6 to 8 feet of the person for 15 minutes of time. That number is a guess. It's not hard and fast. We don't know what the minimal exposure is. Based upon some epidemiological evidence, those are reasonable numbers. I would not look at my watch and say it's only 14 and a half minutes and I've been in conversation 2 feet away from somebody with COVID and say, I have zero risk. That's not the way infectious diseases work. But as a guideline, an exposure is considered significant if it's 6 to 8 feet for 15 minutes. Smaller exposures than that might be very significant. And if somebody's masked and they're 8 feet away, that's not an exposure. Even if you've been in the room with the patient for 3 hours, you're doing surgery on them. That's not considered an exposure. So therefore, each case needs to be handled individually. And as a general rule, and general rules needs to be fine-tuned for individual cases, as a general rule, the CDC definition is a 15-minute exposure, but it's not based upon hard science.
Okay. Thank you very much, Rabbi Glatt. There's no further questions that we haven't discussed in the past, and I think you've covered pretty much everything. Thank you very much.
Okay, everybody should have a good vach. I think next week will possibly be our last week of doing this. It's Slichos already next week, so we'll still probably do it next week. But after that, we enter into Rosh Hashanah already. So Mitzvah Hashem, next week will probably be the last time that we have an opportunity to do this, at least in the immediate Motzei Shabbos, and then we'll see. Well, if a vaccine comes out and B'ezras Hashem, I'm out of business on these Saturday nights, I would like to reserve it to give a shiur instead on some wonderful Torah subject, and would love to see 1,000 people come into that rather than some of the attendance numbers that we have for other shiurim. But that's a wishful thought. B'ezras Hashem, it should come true. Have a good time.
Thank you. Good luck.